Thank you, Mr. Governor. Thank you all. To reiterate some of the information that the Governor just shared, as of today, we added 7 new individuals with COVID-19 for a total of 13 currently identified as presumptive positive cases in the state of Louisiana. We are sending samples to the CDC for their confirmation, but we are confident in our test and believe these are individuals with COVID-19. And our team in the Office of Public Health and at the Louisiana Department of Health is working with healthcare providers, the individuals, and their close contacts to quickly identify individuals who could be at risk for having come into contact with those individuals, and ensuring that they're getting the proper messages about how to take precautions for themselves, and again, take steps to mitigate the spread or slow the spread of COVID-19 in our state. As the Governor also said, we do believe, given that the majority of cases that we have so far are in Orleans Parish, several of which, most of which, don't necessarily relate to each other, that we do have community spread, at least in the greater New Orleans area. The most important thing that people can do with that information is be sure to take the advice that you just heard. And that's cover your cough. If you are sick, you should be staying home, contacting your healthcare providers, where they will talk you through an assessment just as they would any other time. We should all be washing our hands frequently, and that goes for the entire state, not just the greater New Orleans area. And thinking about how much contact we have with older individuals, our loved ones who may be older, or friends and family, or individuals who are ill, have chronic conditions, especially lung conditions, conditions that affect their immune systems, to make sure that we're not putting people at risk for transmission, for acquiring this infection. One thing to stress, what we have learned from the global numbers and data that we have about this epidemic is that most people have relatively mild symptoms. 80% of people have mild symptoms related to this infection. Our steps that we're taking now to slow the spread is really focused on keeping it from those individuals who would be at highest risk for more severe symptoms. And that's why you hear the steps that we're talking about: travel limitations, contact limitations, limitations in going to events, especially for older adults and individuals who have chronic infections or chronic conditions. That's also the reason that we, in collaboration with the New Orleans Health Department, since last night have been working very closely with the Lambeth House, where we do know there would be increased concern for those residents and the potential for many of them being vulnerable to more severe effects of COVID-19. We are really pleased to say that Lambeth has been nothing but supportive and a clear partner with their clear communications today, so that we really can assess that situation in collaboration and really in support of the New Orleans Health Department as quickly as possible. And so again, we will continue to update the public, as the Governor has said, and as we continue to commit to, with twice daily updates of the LDH website, so that you will know presumptive cases as we have them. We're also continuing to work very closely with healthcare providers, community leaders across the state, across our whole government response to coordinate their preparedness and response activities as well.